Joining us from London is John McConnell. He's the editor of the Lancet, one of the world's oldest and most prestigious medical journals. And with us from Spain is a professor of preventative medicine and public health at the University of Valencia, Dr. Jose Martin-Moreno. Gentlemen, thanks to both of you for joining us. Dr. Martin-Moreno, let me start with you. You and others have written a letter to European leaders severely critical of what you say is their failure to act to bring the Ebola epidemic under control. What are your main problems with what they are not doing?
Well, right now we have like a massive burning bonfire in Africa. And the fire is extending throughout the continent. And the sparks are going to affect all of us. So it's a question of solidarity, and it's a question of a tactical public health approach to actually help them, to strengthen the health systems, and also to support them with human resources and with diagnostics labs and resources, basic resources, in order to help them to cope with this epidemic, which is terrible for them and for all the globe.
John McConnell, more than 4,000 deaths since March. How big a threat is the Ebola epidemic to global health security?
I think it's a substantial regional problem, and I think the people with infection will travel, and they're likely to turn up anywhere in the world. The greatest threat is in West Africa itself, is in the countries surrounding those which are currently affected: Senegal, Guinea, Sierra Leone and Liberia. It's countries like Ghana, which I think are probably most at risk. But patients with Ebola are highly likely to travel to Europe and to North America.
Dr. Martin-Moreno, what would you like to see from European governments right now?
I would like to see a clear determination helping the initiatives also led by the US, and by President Obama has had very clear that they have to deploy human resources and material resources and healthcare resources in order to help, the Western African countries to curb the epidemic. And this is a need. The more we wait, the worse for all of us. I would like to see, leave of absence, which is facilitated by the governments, with a hazard pay on top of that, for volunteers, helping, the Western African countries to cope with this, to help the health system. It's not to do this for them, it's to strengthen their health systems. And with this kind of approach, with good micro labs, which are able to, then it will facilitate them to isolate the right Ebola patients, and not everybody with fever or with a theoretical contact with an affected person. So if we isolate the right person with Ebola, and then we put in quarantine those who were in contact with this Ebola patient, then everything is going to be much more effective. But they need every basic things, from gloves, protective equipment, even soap, and to be really able to cope with this challenge.
Mr. McConnell, what do you make of the international response so far?
Well, I'm slightly encouraged that it is beginning to ramp up, but I'm a little bit concerned that it's still not moving in quite the right direction. What's unique about this outbreak, and which has never happened before with Ebola, is that it's now embedded in huge urban communities. Previous Ebola outbreaks have always been sort of somewhat isolated rural affairs, and we do need intervention at that sort of community level. So it's all very good, well and good, and it's very important to build treatment hospitals, but we also need to get out into the communities. We need to have local clinics. We need to have local intervention. We need to have people able to access clinics at a very local level, and we also need to have a lot more community education about the risk factors that lead to Ebola infection and their prevention.
Dr. Martin-Moreno, both you and Mr. McConnell raised some important points there about what's being done on the ground right now. There is talk of building what are known as isolation wards. I mean, are there enough isolation wards there? Are they being built? Are there plans to build them? And really, are there enough volunteers to get in there to treat this disease?
Yes, well, I am sure that there are quite a few volunteers that would be willing to help, not only because of solidarity. For a public health spirit, I have checked throughout different, European trips that they will be ready to go. Obviously, there will be the conditions to make this feasible for them in the public administration to have this leave of absence. And regarding isolation ward, obviously, there is a need to keep improving the health systems because they are extremely weak.
Mr. McConnell, you wanted to tell us about the actions being taken on the ground right now.
Yes, well, my understanding is that the USA is going to build about 1,700 hospital beds. The UK is contributing about another 1,000 or so. The point about healthcare workers is, of course, that they need to be properly trained. You can't just send them out there without the proper training. We've seen how risky it is already for healthcare workers who are treating patients with Ebola, and there's already been a couple of cases of transmission in the United States and in Spain. So you can understand how risky it is for healthcare workers working in these countries in West Africa, where the conditions are not nearly so good as they are in Europe and North America.
Risky it is. We're hearing that almost 100 healthcare workers have been killed. Dr. Martin-Moreno, you want to say?
No, that I fully agree that the protocols for putting them on and taking them off all the protective equipment and things like that are very important. And the training for that, for people with the proper willingness to help, it's not too complicated, but it's true that it's needed to send people with the proper discipline, and this is key for the success of this endeavor.
Mr. McConnell, what do you make of international efforts to screen airline passengers who are coming into airports, not just here in the United States, but we've just heard that Heathrow Airport, for instance, in London is now going to screen passengers coming out of West Africa. Is this going to be an effective way to stop the spread of Ebola?
Do you want a simple answer to that? No, it's not. There really is a lack of scientific evidence that screening at entry will prevent people with Ebola coming into countries. Let me just give you an example from the SARS epidemic, which was in 2003. Now, during that, there was airport screening was introduced in countries in Asia and in Australia, and millions of passengers are screened, and no cases of SARS were detected at all. I think Ebola, in some ways, is quite similar to SARS in that it's actually not that contagious. It's quite difficult to spread. You need direct contact with the people who are infected, and it only spreads when people are showing signs and symptoms of infection. So in that way, it is similar to SARS, and I think we can take that as a model of how effective screening at airports is likely to be. Where we should be concentrating screening efforts is at departure in the affected countries.
Right, and Dr. Martin-Moreno, if we talk about screening at the points of departure, as Mr. McConnell there was telling us, I mean, is there the, what can I say, infrastructure, healthcare infrastructure at these airports in West Africa to conduct screenings of this type?
I fully agree. I cannot agree more that effective screening in origin countries is the key, if we can do anything. I mean, obviously, but even then, the incubation period of up to 21 days, means that many asymptomatic carriers will incubate and not be identified, even if they have these screening methods in the countries of origin. But in any case, they have all these thermometers, which are different devices in order to keep the temperature, to actually check that nobody with fever should travel, should be isolated, should be controlled. And I think this is a key point, much more important than the screening and the destiny of the international airports.
Mr. McConnell, is there a plan, a procedure in place to prevent the spread of diseases like Ebola right now? Not just something in response to this particular outbreak, but a general plan to counter the spread of internationally of a disease like Ebola?
Well, there of course is a set of regulations called the International Health Regulations, which were revised in 2005, and they were designed to help combat the spread of Ebola and similar sort of diseases. So, for example, polio has been in the news this year before Ebola became quite so prominent, and it's also diseases like polio, which countries which detect cases must notify the WHO. and so that information can then spread to the global community, and that countries are aware that there is a risk of importation of these diseases. And this is probably the first real test of that revision of the international health regulations, which, as I say, was they were rewritten in 2005.
Mr. John McConnell, Dr. Jose Martin-Moreno, thanks to both of you for joining us.